Hello guys, welcome back to Medico DIY, and today in this video we'll be talking about cellular adaptation. Cellular adaptation. Cellular adaptation refers to the reversible changes which occurs in a cell, which can either be physiological or pathological. Whenever a cell is subjected to a force, this force can be either be external force or an internal force, then the cell undergoes cellular adaptations. The cellular adaptation occurs mainly in 5 forms. These 5 forms are hypertrophy, hyperplasia, atrophy, metaplasia, and dysplasia. In this diagram, it is shown that whenever a normal cell is subjected to a force, external or internal, it may undergo a reversible change or irreversible change. The reversible change can occur in the form of change in cell size or number, that is hyperplasia, hypertrophy, and atrophy. Hyperplasia, it refers to change in cell number, and hypertrophy and atrophy refers to change in cell size. Whenever the external forces are very severe, resulting in inability to adapt, or whenever the normal cells are subjected to severe stress or injury, it results in irreversible injury known as necrosis or apoptosis. The normal cells also undergoes reversible changes in the form of change in cell structure or change in cell type. The change in cell structure is known as dysplasia, and change in cell type is known as metaplasia. As we compare in this picture, when the normal cells undergo metaplasia, there is change in one form to another form. Here, the normal cells are denoted by a pink cytoplasm, but whenever it undergoes metaplasia, it is changed into a green form. That is, one cell type is changed into another cell type in metaplasia. Whenever a cell undergoes irreversible changes, or if the chronic irritation persists for a longer time, the cell undergoes irreversible changes known as neoplasia. Now let's talk about each of the cellular adaptations one by one. Hypertrophy. Hypertrophy, it is a type of cellular adaptations where there is increase in the structural proteins and organelles, which ultimately results in the increase in the size of the cells. Here, no new cells are formed. In this picture, there are 4 normal cells. After going hypertrophy, the cell number is still the same, but the cell size has increased. The physiological hypertrophy, it occurs during pregnancy when there is increase in the size of the uterus, or in the lactating breast, or increase in the muscle size of the bodybuilders. Pathological hypertrophy, it occurs in cardiac muscle hypertrophy due to hypertension, or smooth muscle hypertrophy due to achalasia in esophagus. Hyperplasia. Hyperplasia is another type of cellular adaptation in which there is controlled proliferation of the stem cells and differentiated cells, which results in the increase in the number of the cells. In hypertrophy, the cell number was constant, while in hyperplasia, the cell number has increased. Here, there are 4 normal cells. After undergoing hyperplasia, the cell number has increased. We need to remember that only cells which can divide can undergo hyperplasia, like the epidermis, intestine, and bone marrow can undergo hyperplasia, while the monocytes and neurons, they do not undergo hyperplasia. The physiological hyperplasia, it is usually seen in female breast at puberty and pregnancy, and regeneration of the liver after partial hepatectomy. The pathological hyperplasia, it occurs in various conditions like benign prostatic hyperplasia seen in male aged more than 50 years, and endometrial hyperplasia due to estrogen excess. Talking about atrophy, whenever a cell undergoes atrophy, there is reduction in the size of the organ or tissue due to decrease in the cell size and number. Here, there are 4 normal healthy cells. After going atrophy, the cell number will also decrease and the cell size will also decrease. The atrophy can either be physiological or pathological. The physiological atrophy, it occurs in the decrease in the size of the uterus out of parturition or childbirth, or atrophy of the brain with aging. The pathological atrophy, it occurs in denervation atrophy, ischemic atrophy, and starvation atrophy. Metaplasia. Metaplasia is another type of cellular adaptation where there is reprogramming of cells. That is, one cell type is converted into another cell type. In this picture, these 4 pink cells, after going metaplasia, have changed into green type. That is, one cell type changed into another cell type. In metaplasia, there is replacement of the one cell type to another cell type to adapt to the ongoing stress. The metaplasia can be of 2 types, that is epithelial metaplasia and mesenchymal metaplasia. Epithelial metaplasia, it occurs in Barrett's esophagus, where the squamous epithelium of the esophagus is converted to the columnar epithelium to overcome the acidic pH of the stomach. or it occurs in trachea and bronchi of the chronic smokers, where the columnar epithelium is converted into the squamous epithelium to adapt to the effects of smokes. The mesenchymal metaplasia, it occurs in myositis ossificans, where there is formation of the new bone within the muscle after trauma. Dysplasia. Dysplasia, it is disordered precancerous cell growth. Whenever there is severe dysplasia, it changes into carcinoma in situ. The dysplasia, it is not considered a true adaptive response, and it is characterized by pleomorphism, that is loss of uniformity of cell size. Here, 4 healthy pink cells have changed its shape after undergoing dysplasia. A change in cell size, shape as shown in this picture, and nuclear changes, that is the nucleus has become much darker and more chromatin is present. Severe dysplasia, it often becomes irreversible and progress to carcinoma in situ. This much for today. Thank you guys for watching the video. If you want to get access to the PDF, you can get access via the study pool. I will also add the link to the file in the description box below. Please check it out and stay tuned for more videos. Thank you.